What is up, guys, and welcome back to the channel. Guys, we here talking about Australian healthcare. I went through and found this video. If you've been on the channel, I always talked about the US healthcare system, and recently been doing a lot, or not recently, but before I have checked out how it worked in Europe as well. The healthcare, the free healthcare, free education, all those things. If you know or don't know, I posted a video probably like a month or so ago. I ended up needing knee surgery because I tore my patella, and I actually have a video that you probably see the cards. I don't know which way it's gonna be. It's just gonna be at the top if you want to see that video, just the price breakdown of my situation on how much I had to pay to get surgery done and stuff like that. But yeah, the healthcare system here, definitely not good. Definitely those more beneficial to if you have a good job. And then again, it really depends, because if you have a good job, they're probably going to charge your insurance more, and you might have to come out out of pocket still on some of the money and stuff like that. But we finna check this out. Check out Australia. I believe Australia is a free healthcare system, of course, with the taxes and stuff. I thought I heard someone say that on a video before. So we finna jump into this. Y'all hit that subscribe button.
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's Healthcare Triage. Like pretty much every other country we've covered, save the United States, Australia has a universal healthcare system. It's called Medicare.
Okay,
what is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare. Anyway, Australia's national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are under review. Australia also has a voluntary private health insurance system, which complements and supplements the public one. It can give citizens access to private hospitals and some services not covered by the public system. The tax system incentivizes the purchase of private insurance for many individuals and families. Medicare also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans. Medicare pays for somewhere between 85% and 100% of outpatient services. It also pays for 75% of the medical fee schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else.
And see, I ain't gonna lie, I think for my prescriptions on the pills that I needed after my surgery, I think I paid like $30 or $40 and stuff like that.
Out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee schedule for doctors for the rest of the year. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year.
It's not bad.
For people in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated. Thanks, Australia. There are also ways for families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year 2 for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems. At 8.9% of GDP, Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income. In 2010 to 11, the government funded about 69% of spending, 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending, in co-pays or services not covered by insurance. Private health insurance accounted for about 8% of spending. About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they receive. Those who opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives. Each year, an Australian waits to start buying private insurance after they're 30 sees their rates go up 2% from a base rate, again, for as long as they live.
That's almost like down here. I don't know if it works the same enough. And this is not about healthcare, but car insurance. Our car insurance, it does the same. Like, everything is super high when you're under 25. Once you turn 25, I guess they believe, oh, you're more mature, you're older, experienced driver. That's when like the premiums, all those things become cheap down here. And I think that it might work with some other things too, but I know for sure car insurance work that way to where once you turn a certain age, it's a certain price that you have to pay. But all in all, I think this is, like I said about Europe, the universal healthcare is something that we definitely need because it would literally cost you an arm and leg in the United States to have surgery. Like, people not even dying off that injury, they're dying off of freaking having to pay these bills, stress, and all that stuff.
Subsidies have been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists. Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards. And, as I mentioned before, pay-for-performance systems are in place to encourage better care. Some healthcare organizations and professional boards also have quality improvement programs. All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down. Almost all brand name drugs are bulk purchased by the government, which can also control pricing. New drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets, but as with some other countries, this can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the US. The private overlay makes...
I think everybody beating the US when it comes to higher education and healthcare. The main two things.
Some people there are concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries. And Australia does it for a reasonably small amount of money. In summary, Australia has a pretty robust public healthcare system with a private overlay that half of people use for better access and services. If that sounds familiar, it's because it's much like other systems we've talked about, including France.
Yeah, I need to check this one out about the US, but just to see, cause maybe I don't know. I know how it was for me in my situation. and stuff. Cause like even when I try to get assistance for my surgery, okay, it's a whole lot of money. I'll let y'all watch the video. It's a whole lot, way too much if you ask me. But they were like, you make too much money, so you can't even get assistance. I'm like, well, by the time the money hit on how much that surgery cost, then I ain't gonna have that much. I ain't gonna make that much. I ain't gonna have that much because I was out and all that stuff. So, but yeah, the U.S., they all about them coins. I feel like there's enough money here in the States to where they can figure out a way to help people more. I just think other countries value their people more. Our value is only based on what you achieve, what you have. Like it or not. And I know people that are successful. Don't get me wrong. I definitely respect success. Success is different. It's measured different in different ways, But most people, especially if you ask a kid, they're going to think somebody's successful because they got a nice car, nice house, and all those things. But that don't always equivalent. It's not always equivalent to success. And that's what I believe. We're valued by, oh, you got to do this. You got to have this. If you got this, then boom. Then here is based on if you have a good job that's going to provide the good benefits. That's what it's based on. So think about all the people probably working part-time or working a full-time job, but it's not too, not too valuable, too up there in status. They're getting sucky insurance, getting very bad insurance to cover things, or they're just not getting it at all, so, but that's all I have. Y'all let me know what y'all think about the healthcare system in Australia. I definitely better than here. Definitely better than here. I see their mission is to make things affordable. The U.S. mission is to make sure they're green. So, I don't know. Y'all hit that subscribe button and y'all be blessed, be the best, and be you. I'm out.